All right, so these are gonna be some videos on how to roll out your legs because there's a lot of different areas we can, but these are gonna be 4 of the main ones that I want you to focus on. And the first is gonna be the hamstring. So the hamstring insertion point connects here on the bottom to where the gluteus maximus begins. So we're really only concerned with where the knee flexes, right back behind here, all the way to where the posterior begins. So what I'm gonna do is I'm gonna place my lower part of my hamstring right on top of that foam roller. I'm going to pick my body up, and then I'm gonna slide all the way down to where you see that curvature here where the posterior begins. So right now I have full weight of my leg on top of this foam roller. And we're gonna do this for about a 15 count. So back and forth 15 times. Now next is the IT band. This is the area that's affecting you the most, which is partial gluteus medius, gluteus maximus, as well as this long piece of tissue that connects from the hip joint, essentially down to the knee joint. This is the vastus lateralis quadricep muscle. So this is what primarily we want to hit at the bottom of the movement, all the way up to just before where the hip bone is. So now I got to get onto my side. And this is going to be a little bit painful because the tissue itself is inflamed. It's soft tissue, but it's really inflamed and it's going to feel really hard as you're going back and forth. So I want to position my back foot on the floor so that I have some balance on this bipod here. I could also place my hand here if I want more of a tripod. But again, I only want to roll down to where the knee starts to flex, all the way up to this side of the hip here. And again, I want to do that for about 15 times. This next one is my least favorite because I have notoriously tight hip flexors. So I'm going to place where my hip flexor begins, not the hip joint, but like the hip flexor muscles here. And then these are the beginning of the quadricep muscles. I want to roll all the way down to where these muscles end and where my knee begins. So I'm going to place one leg on top here. That's right there at my hip flexors. And I want to pull my body forward. This one's going to be a little hard because this is a longer range of motion. So what I have to do is I'm going to switch legs here just so I give you a better perspective. I got to sort of like walk it forward a bit. And I got to create a long range, a long reach with my arms. And again, I'm only trying to hit from these hip flexors down to that quadricep. So you see how far my body sort of has to move to get into position for this. And I'm going to show you on this side over here, just like how far my body's sliding all the way up and down. And again, we want to do that for about 15 times. Now the last one is going to be directly related to the posterior. We're just going to sit on top. This is going to be the easiest one to do. All I want you to do, extend that leg a bit. I keep the weight of the leg off of the floor so that the weight's sitting on top of the foam roller. And I just want to roll in that specific spot. So we started off hamstring. We went to IT band, and then eventually went to our hip flexors and quadriceps. Then we hit one very specific area, small area, and we're going to do this for about 15 times as well.